you guys put messages in the chat if you can see us.
All right. Yeah, when there's
Okay,
some
there we go. And
chance,
that's
we
all I
are
needed to know.
live. Yeah.
Fantastic. Well, thank you guys so much for taking some time today. Sometimes I just feel in these times of crisis like a very fortunate person because I have so many just super smart, amazing people around me that actually can help calm me down and make sense of what's going on. And so, really today I'm kind of bringing all these perspectives to you guys and kind of I'm sharing my smart people with you. Uh, I mean, there's definitely a lot to cover. And so we're gonna try to cover a lot in this meeting. If you have questions throughout, just put them in the Q&A, and we are going to answer those after we kind of each go through our little presentations. But we're going to take you through the history. We're going to go into the plant a little bit. We're going to go into the medicine and the future of medicine, and then go into the our favorite place, the back rooms in Capitol Hill. And then we're going to talk about, what this really means and where we go from here. So I'm just going to jump in. And again, thanks everyone for joining us. What's really surprised me the most in this whole thing is how many people have said, "This is crazy. I can't believe this is happening." Especially people who have sat through more than one presentation that I've given on federal policy for the last 2 years, that I said, this is what's going to happen. Not because I'm super smart, because it literally was in the legislation. So, but don't feel bad if you didn't know this was happening, because people are spending a lot of money to make you and shareholders and potential shareholders think that everything is going really well. So we've got this sort of parallel of misinformation going on in broader politics and in our society. And then we have it ramped up within the cannabis sphere. Um, so I will say that it is not a big surprise that this happened. That actually, this legislation, we saw it first in the Farm Bill that didn't pass in 2024. And then I think people just got tired of waiting, I guess, for the Farm Bill. And so, people who really wanted to see this loophole closed, and honestly, people that were just not sure how to deal with this and feeling like, states were, their hands were tied, and so they were just looking for a way to move forward. Put the language from the Farm Bill, which a lot of people called the Miller Amendment, which really was set to define hemp products. And so one of the big fiascos, and there's all sorts of rumors of how this happened, and lots of people have taken credit for it, that they were the mastermind that kept definitions out. I'm not sure how you feel today, but so people have really been going blind. There was no definition for what is industrial hemp, what are hemp derived cannabinoids, and so there's been almost every state has been dealing with this, lots of different associations and organizations. And so what happened is in during the normal appropriations process, that language got added to the Ag bill in both the House and the Senate. It passed in the House, and then when it went to the floor in the Senate, everyone thought it was gonna, because it was in the original text, so people thought it was gonna stay in there. And then Senator Rand Paul pulled it out, like pulled it all out, and was talking about, I think he put in some report language for like an 18-month study, which was definitely not reading the room, especially for folks that have been working with state governments. So then we went into shutdown. And so there were lots of rumors about what was going to happen, and there were, various different ways that the government could get started again. And so they literally picked like something out of each pile to get the government going again. And one thing they did was they picked three of the appropriations bills and put it together and called it a minibus, which I hope I never say minibus again after the presentations that I've been giving over the last few days. And then all of the other appropriations bills, were part of a continuing resolution, and then there was some stuff saying we're going to follow the law. So they're like, we're going to pay back pay, all these things that they were going to have to do anyway. So government shuts is back on, right? I think people were kind of freaking out, reaching out to Congress, hoping that they were going to amend this in some way. We actually didn't put out a an alert for during that time because honestly, the writing was kind of on the wall. But also, people needed to go back to work. I mean, kids didn't have, lunches. I mean, there was a lot going on. So this is where we're at. So this has passed. So this language is law until at least September of next year. It's a regular bill. And so what it means, what the if for the practicality of the products that are on the market in 365 days. Oh, that's a year. I'm just kidding. In 365 days, um, basically these definitions for hemp, industrial hemp, and for hemp-derived products go into play. And the only products, as far as patients are concerned, that they would be able to have access to would be isolates. So as long as they didn't have THC. So these, and we'll get to the definitions. I'll let Pam actually talk about some of those definitions. They're going to be coming from FDA. Um, but they would be able to have broad spectrum CBD products, but not full spectrum. And that is because, and potentially, I'm sure people are going to get creative, right? They're going to come up with like single servings that have zero point 0.4 milligrams of THC. I'm sure it's already being designed. But my favorite was watching the Senate try to define a container. So they're literally like tried all these different ways to define a container, and then they said, and we'll let FDA tell us what a container is after they like literally define something with inside package, outside package. So that's where we are. And there again, there's 365 days until this happens. So you don't need to start hoarding products. And actually, we're going to be doing some webinars on how long you can store products so that you're not making investments that are gonna end up with something you can't use. So
Refrigerate them.
that is sort of where the policy lies. And I'm going to talk in a minute about some of the solutions and where we go from here. But I do want to just add this just a little bit of a perspective, which is that all cannabis policy has been built on loopholes, right? So I'm not judging people for looking at loopholes and trying to find their way through it, right? The systems that we see of access, they started with a few of us coming up with a very creative definition of caregiver, right? That was a loophole that we took a Mack truck and drove it through. But we also knew what we wanted on the other side. So as we started gaining policy, we turned that loophole into state programs. And I think what we saw here is this loophole. There wasn't something on the other side for patients, and that's the sort of the reality that we're dealing with now. And I also just want to say that this isn't what I've learned through this experience is that this isn't really our loophole, right? That what we've been calling hemp products, are really medical cannabis products. Hemp is a cannabis plant, and so we're going to talk about that and maybe talk about realigning and going back to the work we were doing, which was trying to create a national medical cannabis program. And so the 20 million of you out there that are using these products, it's time to start talking to your member of Congress. So with that, I am going to hand it over to Cody and have him jump into the plant.
But I definitely want to stress that is patients do not serve the name of what we call it. We're dealing with the same cannabis plant and oftentimes the very same medicine. And so these two legal frameworks that emerged in the history that Steph just shared with us were the moment. They were the progression. That's how we got there. And some of them were intentional. Some of them might have been unintentional. And unfortunately, this loophole has now closed sort of unexpectedly or sort of rapidly. Unexpected might not be the thing. And we're all kind of scrambling, well, what the heck do we do now? So that's why we came here today. We've got Steph's leadership here. We really appreciate Steph's hard work to get this up started and try to deliver you guys some information, kind of calm everyone down. We're going to address this. We're going to find solutions that can help support patients, that can help support even people who are in the space already and trying to find their new pathway forward. This is not the end. This is the next evolution of this journey of medical cannabis. So back to really what I want to talk about. First and foremost, hemp and marijuana, that's a legal definition. But what we're talking about in a scientific textbook is cannabis sativa L. There's a fun story about where the L comes from. I'm not going to share it now. But these are the exact same species of plant. And just like the plants that grow in your garden, for example, a cabbage and a kohlrabi, you can grow them for different purposes. They can look a different way, but still be the same thing. And guess what? Both those plants, they kind of have that funky cabbagey smell, just like cannabis can have a very similar smell, whether it's hemp or whether it's marijuana or cannabis, as we've more recently adopted. But the only difference is this legal definition where the product, the final product, has less than 0.3% THC. So that was what was established in the 2018 Farm Bill, is that if it has less than 0.3% THC, it's hemp. Right? And the idea is that THC is intoxicating, and therefore, if we limit around that, that we will have a good, healthy system where we can focus on growing food and fiber and clothes and even medicine. Okay? So in my Venn diagram here, you can see these are the same plant. They both produce cannabinoids. The definition is based on this one cannabinoid, THC, the psychotropic molecule, but they're both medicine. They can be extracted for medicine. They can even both contain the exact same thing, as I'll show you an example if it made it into this slideshow next. As you guys, everyone here knows, we have this sort of legal, almost nationwide situation as it relates to hemp. So here's an example of a product, and I use this product not because I have any affinity or affiliation with it. No, the truth is I had a patient taking this exact product in the state of California. And that's over there on the right. That was a 30-1. Worked great for him. We dramatically reduced his seizures. He's a little boy. It was a tremendous win. And of course, as the industry has faltered in California, this 30-1 product is becoming increasingly difficult to find in local dispensaries. And so the patient converted over here to what's known as Papa and Barkley hemp. And what is in that product? It is 30 milligrams per 1 milliliter, which is the same as the product on the right, and 1 milligram of THC, which is the same. These are identical products promoted by the same brand, but depending on where they have a license, depends on where they do it. But if my patient was taking the marijuana product and getting seizure reduction, and then had to convert over to a hemp product, should these really be regulated in different categories? Do they deserve this sort of different treatment, or do we really maybe need to think about a more unified approach to cannabis sativa and potentially even fit for purpose regulations? I think obviously I'm kind of suggesting that that's true. Now, I want to just real quick point out, you can't really see it. Hold on, don't move ahead yet. You can't really see it because it's really tiny labeling. But over here on the left, the hemp product, it says very clearly on it, full spectrum CBD. And on the right, it doesn't say that at all, interestingly enough. It says CBD dominant. But in both cases, as I mentioned, these are almost the exact same product, and their certificate of analysis was rather similar. I evaluated it, and it's really just about what market they're being sold on. Now, of course, if this was the high THC product, these would not be the exact same situation. We would see marijuana or the high THC product regulated differently, and that would have not been permissible under the old hemp laws or under the new legal definition, which limits it to the 0.4 milligrams per container size. So, the takeaway here for me is we can have the same thing. We can have a full spectrum whole plant extract placed into the same ratio. We can call it hemp or we can call it marijuana, but in the end, it's this complex medicine that we're dealing with, not just the CBD and THC ratio, although that is important, but also these potential minor components and the terpenes as well. We have this complicated botanical, and we need to come up with regulations that make sense. And going off of one ingredient that is existent in botanicals is going to inherently leave us a little bit confused and a little bit lost in the sauce. All right, we can go to the next slide. It's medical cannabis. I don't know how else to say it. We were using it for medicine. It's extracting its effect, basing medicine versus hemp or marijuana versus hemp on this one THC is inherently going to lead us here. We know that this is beneficial, and I just want to point out ratios matter as well. We know that when we were talking about hemp, we are very limited in sort of how many milligrams. Now it's 0.4 milligrams in an entire container of hemp. But these ratios are really an important factor when we're managing medical cannabis, and that's I guess really all I want to say about that is we're dealing with medical cannabis. It is this very comparable product, and so even though this feels like a loss, maybe we can find a way to bring these two worlds together. I just want to point out in the next slide, we're talking about chemistry. And the chemistry here is coming from the same. We've got the same plant making the same molecules, and depending on what enzymes are active and certain factors around that plant, we get different production. So this is a really sciencey graphic. I apologize for those who aren't interested, but we definitely have this same therapeutic category coming through. Sorry, I just jumped ahead to the next slide, but referring to the last slide, we've got the same biological processes involved in making one and the other. Once again, writing regulations around which enzymes are present in a plant or even the seeds of those plants is inherently going to come with challenges because patients don't choose their medicine based on sort of which enzymes are available in the plant. They choose their products based on what works for them. And it really doesn't make sense to try to put this big fork in the road dictated just by that THC percent. My next slide is a little bit less relevant, but I think it is important. We've got products on the screen here that you could characterize as marijuana, right? According to the federal definition, which is on the left. These are true synthetically made dronabinol, which is identical to Delta 9 THC. The FDA has approved that for many, many, many years. So that would hypothetically be marijuana. It's FDA approved. The product in the middle is Epidiolex. It's a plant-derived CBD concentrate that is extracted from a whole plant, and it has less than 0.3% THC. So that would be hemp. All I'm trying to get at is we've got all these overlying regulatory pathways and sort of weird carve outs for what is what. You know, this, for example, dronabinol, the synthetically made THC, is a Schedule 3 drug or a Schedule 2 drug, whereas the botanically derived from the plant is a Schedule 1 drug. Just really trying to drive home that we've got a lot of lack of clarity in definitions, and there's much more to do. Once again, patients don't choose their medicine based on whether it came from hemp or came from marijuana. They choose their medicine based on what works. And these products, whether it was something that's being procured in the hemp market that is rich in CBD, CBG, and has some THC, or whether it's this a product coming from a state legal medical or adult use marijuana market and there still has, again, these components, we're still using medicine, and it's important not to get lost in there. Hemp is a legal definition, not a pharmacological category or some sort of special plant that grows differently and isn't intoxicating inherently. By limiting to 0.3% THC, we do reduce the total amount of psychotropic effects, but a dose makes a poison. As we know and have seen, you can absolutely take a hemp product and still feel the effects of THC. It is not as clear cut as we want. One big win we got in this, I would not, maybe not big win, but a win that I think comes with this new language is that we're no longer going to be dealing with so many synthetically derived cannabinoids. And there's some complexity around who's going to decide that and what it all means. But for a long time, because of the legal definition since 2018, people have been able to sort of skirt the sort of inherent the meaning of the bill and sort of run wild and create semi-synthetic drugs such as Delta 8 THC, Delta 10 THC, HHC. There's a bunch of them that are no longer going to be available through that loophole. So I would say this is, and in general, most of the people that I've talked to have seen that as a positive in this very challenging bill that has come forward.
Until we see the loophole of the loophole. I'm just kidding.
Yeah, we'll see what loophole we can find in the current language. I think that's, I've already seen some dialogue around what a container is, as
Yeah,
you
yeah.
kind of mentioned. So there will be laws and people will do everything they can to get around them. But setting up two different frameworks inherently is going to lead down this path where we bump into each other and we create more loopholes. If we've got two towers, there's just more chances there. So anyway, the certainly I'm concerned about patients and their access to their cannabis medicine. I think this is going to create challenges for patients. But we have a year to figure this out. And to actually help patients, we need more comprehensive reform. And just finding another loophole will bring us to the next loophole. But finding a path forward that serves both the cannabis space or marijuana space and the hemp space, even bringing them and synergizing them is really what we have to do. And I don't want us to give up hope. Patients need us now more than ever to go fight for what they deserve, which is access to medical cannabis.
Wonderful. Well said, Cody. And I think, you know, um, the reason we looked for loopholes, like for instance, in the definition of caregiver, back in the day, was that there was work to be done, right? We weren't able to move into statewide access programs until we created product safety protocols. That's what allowed us to be able to have statewide distribution programs. And in the same way, and I think something that's really been distracted by the access that people are getting, which, is not covered by insurance. People can still get fired when THC shows up. There's still all of these rights that people don't have by using those products, but they feel like it's better than nothing. um, is that we it took us a very long time to change the scheduling in the UN drug treaties, which we did in December of 2020. Our two biggest health agencies have found that there's currently accepted medical use. Who cares about the scheduling conversation? That's the win, right? Like that is the win. The two, like in the United States, like that is the wind in our sails. And so the need for loopholes is getting less and less. And sometimes it's boring as hell to sit down and figure out these regulations, and what to do next. But that's where we're at. And the only way it's going to happen is if we're all involved. So I'm so excited to take the conversation that Cody started, and hear from Dr. Lee Vinegar about how that is translated into your practice, and where you see us going from here.
Yeah, thank you, Steph, and great presentation, Cody. And to build on what he said is the reason people turn to hemp, as it's called, is number one, the cost. You saw the slide in California with the dispensary having a CBD dominant 30-1 versus the hemp product. Usually the stuff that patients have to buy in the dispensary are more expensive. So, when I had a patient that I was, tinkering with a THC dominant product at certain times, but I wanted them to have a CBD dominant, I would tell them to buy from reputable online companies that had COAs to use the CBD that was probably full spectrum and then manage that. So cost is a big issue for patients. And then access is another big issue. There are so many states that are non-medical states now that the only thing they had access to after the Farm Bill was the CBD. So that's important. And, it's true. The definition of hemp, there is some THC in it. I've seen patients that felt intoxicated taking hemp products because, trying to manage how much CBD, even in the essentially 30-1 product that they were taking. So it is the same thing. We've known it's the same thing. And the problem is if those products disappear and the costs go up, I think patients will suffer. The other big issue that we have is education, which is important for providers. And it's like any clinician because, depending on the state, depending on, you're going to see patients that are self-medicating, and that's a big issue. They need to have knowledgeable pharmacists, knowledgeable doctors that can help them recommend and manage and work through all of this, and then just even other clinicians that come into contact with them to understand that. So, healthcare is always evolving, and we really need to evolve, and we need to have affordable but reliable, regulated products. That's part of the problem. We have such a patchwork all around the country. Some states are non-medical, some states are medical without adult use, which sometimes, in my opinion, muddies the water because we start to lose some of those really good CBD dominant products somehow when the medical market moves in, and some states have neither one. And so, you know, and there's a patchwork of standardization too. So we need something more cohesive. And Steph has done a great job talking about how we can create some cohesive regulations to protect patients so that they know that they can get safe and reliable products, even if they're buying something online, sort of over the counter kind of product to handle their medical issues. So it's all interrelated. I work. I have a subgroup that I work in the state of Maryland with a Public Health Advisory Council, where we're looking at provider education. A great article just recently came out with from JAMA talking about a basic cannabis competency that all providers should probably have nationwide to at least understand it. Even if they're not recommending or managing their patients on it, they should understand it. And it's a complicated plant. And we know the US, I also conduct clinical trials, and I'm the chief medical officer at a nutraceutical company. And in Europe, they have herbal prescription medicines, and we're just not very good at that. And we are way behind. And they've had that. There's one product that I'm working on for hair and prostate, saw palmetto. And there's just so much crap on the market. And but in Europe for more than 40 years, there's been a prescription herbal product. And I think that that's something eventually we need to move into, because having, not allowing full spectrum products is an issue, because we know there's something called the entourage effect, where there's all these minor cannabinoids that interact with the terpenes. And we know that there's medicinal property to the terpenes too. So we have to figure a way around this so patients can get the most benefit, but have the most safety. I know as a clinician, I was always worried about these semi-synthetic products that some less reputable companies were trying to work around, using solvents that are carcinogenic and dangerous, creating these products. So I agree with Cody, that's maybe the one good thing out of this whole thing, but now we have to figure out how to move forward with having the availability, the access, and the lower cost of good, safe products for our patients.
No, thank you. And I think that's a perfect segue of really looking at, we have been working as far as the recognition of cannabis as a medicine. It means moving it into the mainstream. It means more people understand it, right? It means that more people accept it. And definitely the work in Americans for Safe Access hasn't been necessarily just to perpetuate a subculture. And I think part of what we're opening up is actually a new approach to medicine, that cannabis is going to be the gateway to other herbal medicines, and really opening that. I took that quote from Michelle Sexton. I love that quote, but she said it like 20 years ago, and every time I think of her boots when I say it. But I think what is also really different about the environment that we're in, and why I'm so nervous for patients right now, is that, it before we passed the CJS amendment, when there were raids happening all the time, every and after ASA started, I should say, when you went into a dispensary, they told you that this is illegal federally and that they're actually committing, federal civil disobediences to provide you the medicine. And they got you involved in the politics, right? And some of it was self-preservation, like they wanted people protesting outside if they were being raided, but there was an awareness, right? And, I think about before I started ASA, the first time I went into one of the 11 dispensaries, um, I didn't know it was illegal. That I got to use my credit card, right? Like people were like it felt so not illegal. And so imagine, you know, not all the people that were medical cannabis patients before that found products in the hemp market, but how many new patients were using that, and they really have no idea that these are illegal and what's happening. And so I think it's really important the language that we use moving forward. Congress did not ban hemp, right? There was a very powerful movement that fought so hard, lawsuit after lawsuit, to bring industrial hemp and hemp foodstuffs into this country. Before 2018, all the hemp seed we ate, it came from Canada. So, that is not banned. And in fact, they're strengthened because their products have now been defined. And so that's another amazing thing for this, that maybe those companies, when they're looking for investment to build, new hemp plastics, they're not going to have to like put this disclaimer, but we could get our crop, like we could be hung up with this other stuff. So that's a big win for them, and I'm excited that that's there. But I think what I've seen definitely at the state level, and I'm sure we've all experienced parts of this, is that we have sort of a hemp lobby or a hemp market that talks about regulations in the press. They've got a lot of nice sound bites about wanting to be regulated. And every single time a state has moved forward to do so in the absence of FDA doing anything, these companies have sued the state. So I don't like, so I'm not really sure what that means. But, they also are good at getting patients really upset in the state, right? That they're going to lose their medicine. And to the point that I've heard many patients say that full spectrum CBD only comes from hemp. And like maybe they can only find it in the hemp market, but that's cannabis. It's like what you're taking is cannabis. And it could come from a regulated market. It just isn't, right? And so, I've watched patients really put all of their energy into trying to help preserve these hemp companies. And I think what a lot of people didn't see behind the scenes, because you just saw the comments about how they were going to end patient access with this language, was how we got from this language in one of the appropriation bills and not the other, which means usually in like conference you come together and try to figure that out, and why we ended up not with a watered down version of the Miller Amendment, but instead the Miller Amendment Plus. And so with that, I'm gonna hand it over to my dear friend and often touchstone when I feel like I'm going crazy, Pamela Epstein.
I'm already crazy. No. Hi everyone. Thank you. And Steph, I think you hit the nail on the head. Look, is this ideal? No. Is legislation iterative? Yes. Are there good and important parts of this bill? Or this language, I would argue yes. I think, getting the synthetics taken care of, having nomenclature there is really important. Having the FDA, giving the FDA more direction to be involved in this conversation, and having the luxury of 365 days. Because the bottom line, I think I've heard it from everybody so far, is that patients, specifically patients, deserve access and cost of safe medicine. And what was happening in hemp before now was that you had to really search out and find safe medicine.
Mm-hmm.
And what was happening was we had an uptick of poison control calls, and you can see them happening more in states that didn't have regulated marijuana. But every time there was an issue with THC, it was being blamed on marijuana. So this is a recognition that something wasn't working but it wasn't a full closing of the door. And I think that that is a really salient and important moment when I look at it, not just that we industrial hemp can actually thrive now that we have said you are rope and you are not this other thing. And so now you can get access to USDA dollars. Because before it was really difficult. Levi's actually said they didn't get into doing hemp textiles because they were running into issues where what was their product and what wasn't their product. So one of the other things that happened is instead of it being non-detect, which at a certain point the language was non-detectable amounts of THC, we moved to 0.4. Now, unfortunately, some in this space were playing a zero-sum game, and they were working on an 18-month study to figure out how to regulate not dealing with the synthetics, not dealing with the THCA issue, not putting a number on it. And what is that? That's not regulation. So I think utilizing these next 365 days and really ensuring that patients get a definition of broad spectrum, right, and full spectrum. We have the FDA needing to create a list of known cannabinoids in the next 90 days, which one of them are intoxicating. I would like to see the FDA kind of drill down into what is full spectrum so that we know and that we can then craft language that helps to ensure that patients have a very clear lane, because you shouldn't be the shield to allow THCP and this alphabet soup of uber synthetic products into the marketplace. And that's really what was happening, was everybody was the same thing. And so it was hard, even though I was sat in many offices that said, we don't want to get rid of CBD. We do care about patients, but they had to figure out a way to get their arms around a growing problem. Because whereas THC and cannabis does not kill anybody, I promise you these uber synthetic cannabinoids can do harm and can do catastrophic harm, and that's not fair. We don't want somebody going into a store buying a product that has THCP that's 33 times stronger than Delta 9 and not knowing what's going on with their body, or people saying that they had poorly made products that had residual solvents in them. And that we're really going to be able to tackle now. But we should be showing up, and patients should be showing up demanding the definitions that are going to serve them, so that at the next point that we can have a regulatory language discussion, it is very clear how to etch them in and etch them out. And we now have a conversation. I love Cody said it's not the poison, it's the dose. We now have Congress saying that 0.4 of an intoxicating substance that they know is intoxicating is going to be allowed in novel or in conventional food. Like they've just said, this is now something that Americans can get. So we have put the CSA in a compromised position. What other compound 1 through 5 is going to just be out in conventional food at any level? So you're now saying that a Schedule 1 drug that you believe is so harmful, but HHS has now said really isn't, shouldn't be on there. So that, I think, is a really like empowering moment that we can open up the door in a positive way for. So what's going to happen next? I think it's always important for people to know that 90-day clock is a run-in. So it's the 365-day, but the 90-day clock with the FDA. I think if you look at pieces of legislation like the draft discussion of the Griffiths bill, you'll see sort of where some of these cannabinoids are going to fall. California just released its intoxicating cannabinoid list, and CBN, CBC, CBG, CBD, and all of its variants are not on that list. So I think there's good, opportunity there. The Farm Bill is coming. So that is, in fact, the basis vehicle. We went a little bit out of order in appropriations to an authorizing act, but that will be coming from what I hear likely in Q1. And the reason why, as Steph said, why did we do it out of order? Because the Farm Bill used to be something that was passed every 5 years and one of the most innocuous bills in Congress. It has not been updated since 2018. So I think that was one of the reasons that we came in to regulate that now. But I don't think all hope is lost. And if you live in a regulated cannabis state, you have a dispensary. I think it's an opportunity to engage the lawmakers in those states to say, hey, this program isn't accessible enough. I was going here and now I can't. So now I need you to make this program better. If you live in a state that does have a hemp program, Tennessee, Kentucky, any of those 365 days, they'll still be there, but show up because the states are going to grapple with this and they're the ones that are going to backfill in this next year. And so they may overcorrect. So getting in there and making sure that your voice is the singular voice of patient access, not access to all of these other things that come in the back door behind you, that will allow you to get, I think, more clarity and bolster the rules for this particular subset of patients.
Thank you for that, Pam. And I think it's important, you don't have to know what the answer is also. I mean, I think it is, someone was just telling me that they really wanted to be a patient advocate, but they didn't feel like they were a patient advocate in their role as a regulator. And I said, every time you remind people, anytime you say the word patient in one of those rooms, you are a very powerful advocate. So I can't tell you how many times in the last, especially 10 years, where people have been talking and they're like, oh, and medical, or oh, patients. There's not any I'm like, patient, patient. And people, it's like people stop cussing when a kid's in the room. They're like, oh yeah, get patient. All right. But that's okay. But I also, going back to sort of where we are in time, I want to remind people, like, we are winning. Medical cannabis, the concept of this plant being a medicine is winning. And we are not the same of whether or not the businesses that produce them are doing well. Those are two different things, right? Like, we are killing it. We changed the schedule in the drug treaties. WHO is trying to, find ways for access for cannabis. 60 countries have medical cannabis programs. We're not one of them. And so, I encourage people, as we're looking at like what's moving forward with hemp in this discussion, of being okay with being like, that's actually not my issue, right? Like, I want to be clear. Like, I'm not saying I don't care what happens to you. That's very different. ASA has gone out of its way to make sure that we do not create new crimes in the work that we do. But I don't know if trying to find a place for medicine in a farm bill is really our future. And so I think what we're doing a lot of work here at ASA is actually looking at, we're coming on the 30-year anniversary of this experiment in the States. And for a lot of people that just sort of came in the last 5 years, I think they think that the goal is something to do with banking and states, and don't understand that, like, this is just triage. Like, we just needed each of these programs to figure out how some of, these, how to deal with product safety protocols, how to start identifying the different constituent components so we could even have these conversations. But I do think that it is important to stay involved, because it's not just going to happen. I mean, medical cannabis is going to happen, right? But what we're looking at is, are we going to live in a world where it is a US made product? Are we going to be importing it from Europe and from South America, which is totally possible, right? They're light years ahead in standardizing flour and all sorts of exciting things. But I also want to point out that one of the reasons, and I think Lee and Cody mentioned this, that patients were flocking to the hemp market to find products was because of price. And part of that price was because of these crazy taxes, which came from the state programs. And so as we start looking at patients that will not have access in the current, right, as things move forward, I think states have a big role to play to make sure that these products are available. And so some of and actually tomorrow we have a town hall. You can go to our website and get the info. We're actually going to dive into a lot more of these solutions. I'm writing legislation tonight with some folks, some legislative language. But, I think if we look at, if states make a commitment to get these products to patients, they can do it. I mean, we created a vaccine in a minute, right? Like, we can do anything. We just have to want to. And so the 20 million patients need to not sit back and wait and see what happens, and on day 364 go talk to their member of Congress. but really start looking at what some of these solutions are. So at the state, we're looking at ideas of, tax breaks along the supply chain, for cultivators who will grow these high CBD and other cannabinoid rich plants. Maybe even subsidies for them. It depends on how committed people are taking care of patients. Um, People love to invoke us until they have to write a check, right? But there's also, most states actually have emergency management and industrial preparedness tools that they can actually say, you grow this. We're taking over this part of your factory and this is what you're going to make. I don't want it to come to that, but if people really want to make sure patients get these medicines, that could happen. But we can also look at really starting to build towards what we've been building in the states towards a national medical cannabis program, which could mean states could allow manufacturers, people who have a state license to manufacture cannabis products, to actually be able to buy high CBD products from USDA licensed providers, and add whatever they want to on there, that they have to be inspected or whatever. But again, it's the same plant, as we've talked about a lot. So anyway, I think that we should be putting pressure on the states to help figure that out. And then, coming up, Pam mentioned there's the FDA that we're going to be weighing in on. I also mentioned that the other bills actually were just have continuing resolutions. And so we're going to be talking about CJS in just a second, and we're going to be talking about HHS. Like those bills come back up, and there's going to be opportunities there. I'm pretty sure HHS has something to do with medicine, or at least it used to.
You-
And then, we have our federal legislation, which is having a really fun time in Ledge Council right now because things keep moving. But I think it's quite possible in December, and even if not in January, that we're going to see our bill introduced into Congress, where we can actually start talking about an Office of Medical Cannabis and Cannabinoid Control, and a new Schedule 6 that will be able to intelligently look at cannabinoids and not just sort of willy-nilly decide what is safe and what isn't. So, but I think that what is important right now is it's time to put our eyes on the prize. Is this a medicine or not? And just because the access you were getting was better than no access, that's not the goal, right? We want to see this as a frontline medication in the United States. Some of it will be over the counter, some of it will be getting through a pharmacist, but we now have the tools to figure this out. We just ended Act 1 with HHS finding that there's accepted medical use. And so now we have to figure out how to get this to people. And so it also means being mature. No, we don't actually have all the answers, right? There's still a lot of gaps in knowledge. Some of it's just silly, terminology stuff. But what I loved that FDA Center for Drug Management said is that, there's nothing that we've seen as far as adverse events that would that should prevent people from having cannabis, where it will help them, right? So this isn't just like random doctor saying this, like FDA, like we use FDA in our quotes now. They said that the risk is not greater than the reward when it comes to pain and nausea and other issues. So we have a really busy next 3 years, and and this is someone who has had 23 really busy years coming up to this, but this is where it matters, right? We either show up and we show that there is a patient population, because when you're not showing up and I'm walking into members of Congress's office, they're like, I don't know what you're talking about, right? No patient has contacted me. I think they must be happy. So that's how your silence is being translated, is that the only reason hemp has been able to speak for you is because you weren't speaking. So I'm excited about tomorrow. I'm excited to really dive into some of these solutions, and literally everything we've been working towards, people actually want to know now. And so our strategy is a part of the conversation. It's been in all the congressional research reports. They talk about a potential new schedule, a new regulation, a new regulatory scheme. That's us. We've been getting that conversation in. So we just can't look for any shortcuts or easy ways out. Easy ways out. And luckily, some of the mentors I've had over the year have told me that if it seems too easy, there's a problem. So
Yeah.
with that, Nikki, can you hear me? Can you turn your mic on? Maybe she can. I was gonna have Nikki read through the Q and pull some of the Q&A out.
Steph, so for me, I think what I heard was, look, this legislation is presenting us with new challenges. However, this is almost like this is the path that we're now on, and there is opportunity in this new legislation as well. Particularly as we get to these definitions that Pam is talking about, we can find a way to ensure the medicine that Dr. Vineker and I were talking about. I'm just trying to give our audience, like, you know, I get it. This feels crazy, and it feels like we had the rug pulled out. And in some ways, including my dog and my certain patients, they no longer have the access that they had. We're going to find solutions because that's what we do in cannabis and in this space. But now, because of all this commotion, is an opportune time to get what we really want, what we've really been aiming for. And when I say we, I mean ASA, but also I think everyone who's showing up here today, we want a path forward where patients can have access to reliable medicine at an affordable price through reasonable channels.
Yep. And yeah, no, I think, and I love that optimism. And hi Doug. Thanks for your questions. I haven't seen you in forever. Um, but what Doug was actually pointing out sort of about the FDA and the 90 days, and also just looking at like potentials for states, sort of what's been going on with the tension between states and the federal government. That I feel like I need to put some reality in this. Like I'm still optimistic about medical cannabis. And in the same way that this, that what was going to happen to hemp has been on every one of my presentations for 2 years, there's something else that's been on there that I think we have to really know that that sort of this sort of shutdown and people coming, a grip, people feeling like confident enough that they can finally start removing some of these things from the market and putting things back on Schedule One. Arguably, maybe they were always there. Is that Project 2025 is a real, it's a living document that this administration is plowing through. They're about halfway through that list, and state drug laws are on there. And some of what we've been seeing with National Guard and with ICE coming into the states, is in a way it's a litmus test to see, our state's going to freak out. Like what will happen? And what's interesting about Project 2025 when they talk about, federal powers to come into the states, I don't know if maybe just the Heritage Foundation doesn't really understand the power of the Controlled Substance Act, and it's like the most invasive piece of federal legislation to take away individual rights as well as to go into states and do whatever they want. But they're really focused on RICO for some reason, and I think that maybe is the only way that they know that they can get in there. And so, since Project 2025 came out and I read the horrible document, I've had a slide in literally every single presentation that I've given, and it'll be in the one I send out to you guys again, that points out that they want to see, drug laws, federal drug laws enforced, especially where states have moved forward with policies that are harming their citizens, right? And so that, like, we may roll our eyes, but what is happening in the states with parents groups, with legislature, like they're, I mean, you don't need much, right, to do something that you want to do and that you have the legal authority to do. And so, something that just happened right before the shutdown that not a lot of people noticed is there was actually a congressional oversight hearing, that included the Oklahoma narcotics agents and one of the authors of Project 2025 from the Heritage Foundation, talking about these illegal Chinese marijuana grows that are cycling money into the Communist Party of China, which I'm not sure if that piece is true, but it doesn't matter, right? Because at the end of that hearing, the request was to open a RICO task force on marijuana. And so what you and I all know, and I feel like it's not like if we don't say it, they're not going to figure it out, is that once they are, in these states looking at cannabis, they're going to realize at some point, I don't need RICO. I can actually just enforce these cannabis laws. Like actually, all of this adult use is just illegal, right? Like they can actually enforce those. And so, I think as much as we like to talk about how stupid some of the people are in this administration, they're pretty savvy. And I think what they know is what we all know is the financial crisis within the cannabis businesses, that it's not going to take much for people to close down. We don't have the same movement infrastructure to support people. And so, I think that what we're seeing, like in the CJS amendment of sort of pulling away some of the protections in even medical cannabis states around drug-free zones, those are all opportunities to start chipping away. And I think that we sort of taught the DEA their lesson as far as raids, right? Like we made that like they did our press work for us every time they showed up. And so there's a lot of other things that can happen, like letters to landlords saying that they're going to cease their property. And when they did that in the past, maybe half of the businesses closed down. And they're going to use the fact that these businesses are near schools and playgrounds, or apparently video arcades, as their front. So as we're moving forward with all of this positivity and things that are moving forward, know that the forces against cannabis are strengthening. And they're not necessarily about hemp or about the conversations we're having now, but that the anti-cannabis lobby is getting power, and they're backed by I can't say anything being we're a nonpartisan organization. They're backed by a book called Project 2025. So I think it's going to be even more important to really hold your space and say, this is, I'm a patient. That is not about me. There are some real issues that adult use and intoxicating hemp, whatever happens there, need to address, like youth education, like drug driving, and not just say like it's safer than alcohol. And these are real issues that society's gonna have to deal with, and it's not gonna happen in a positive note, right? We're seeing a backlash for drug laws and soft policing. And so that's just gonna be muddying our waters. Right. And so that's even, more of an argument for patients to show up and ask for what we need, and keep our eye on the prize, which is a national medical cannabis program that's integrated into our healthcare systems, that's taught starting in middle school biology class. They learn about the endocannabinoid system, and we become the gateway for better medicine in this country. And so if there are any last questions, let's see. State defiance related.
I have one that might be relevant from the other chat here, Steph. It
Yes,
says from Gail, she says, do you think licensed cannabis entities will be able to buy minor cannabinoid or cannabis isolates, is what they wrote, from hemp companies after the year is up? So is there a way for licensed cannabis entities, or marijuana, I think is technically the term that most states have adopted, can they buy these minors that these hemp companies are allowed in the new legislation to make?
The states are going to have to change the laws.
It depends. Some states have integration. Other
There's like
states
3, right? 3 that are
don't.
starting.
New York has a form of integration. Utah surprisingly has a
Yeah.
very strong program for integration. Oregon has a program for integration. California has a program for integration that will come in 2027 or 8. I can't remember. I'm sorry.
Probably later than that. As a
Um,
Californian, I
Yeah,
will
well,
accept
I
it
mean,
as
they
I
were
later.
think
supposed
Maryland,
to
and I
do
think also,
integration
yeah,
many months
Minnesota
ago.
is, yeah.
But they may, integration actually may speed up because now they're not so worried about all these other cannabinoids. So that's the other flip side of what's happening here, right? The more clarity that Congress gave of the boundaries of the cannabinoids they want to talk about, and look, the phytomaterial is what we've all been advocating for, right? Not the heavy synthetics. The states may be able to build programs and feel more comfortable bringing on those programs so that, yes, minors that can come from hemp that are less costly, that end in less costly medication can happen. And I think that's the important thing about what Steph said about showing up. A lot of these older regulated programs need a refresh. And if this is the opportunistic moment to do that and to tell them, look, this isn't for the bad actors or for the kids, this is for patients, this is for people who really need it. Now you have a more clearly defined roadmap so that you can regulate these products and make sure that we get access to them. I think that then that becomes a really important silver lining here, is the more clarity you have, the easier it is to get states to act.
Right. And I think the other sort of, component within that is that there is a scheduling petition somewhere. I think someone sat on it. But I'm not saying that is going to have the effects that most people say it's going to have. But even if it moves forward as a Schedule 2, a lot of people don't, a lot of people think that there's just like, it says like take cannabis and move it into Schedule 3 or move it into Schedule 2. And Pam and I actually worked on a uh, a diagram to show actually it's really complicated, right? Like cannabinoids are in different places, and so I'll add that into the deck when I send it out so people can see it. But it's not, I mean, it may be, Gail, that businesses that are not cannabis businesses can buy minor cannabinoids and make products more easily, and maybe those companies, that are looking for investment for those minor cannabinoids are going to have an easier time if they're not selling to businesses that are illegal at the federal level. So I think people are creative when it comes to finding a way, and there's going to be a lot of equipment, a lot of product out there. I've been trying to solicit some folks to help me create a pot to work program for people that can take the skills they learned in the cannabis marketplace and take them somewhere else, as we're going to see a lot of changes in this market. So if there are any last questions, and Doug, I see some of these specifics that you have here, and I'll also grab the notes and these questions and give a better answer than what I can give now, which would just be guessing what that what that would mean. So, but I think I think there is a lot of opportunity for resistance if people are want to resist on this. And again, I think a lot of us live in cannabis bubble world, and outside of cannabis bubble world, including in Washington, D.C., cannabis is not very popular. Like, I can't tell you how many times like the smell of cannabis comes up that it literally offends people that they can smell it in their town. And DC is a horrible example when people come there because you can smell it everywhere. And so, I think we just have to remind ourselves that people don't love this as much as we do. Also, that a lot of the talking points that are coming out of SAM, coming out of the parents groups, are actually the same exact things many people in the cannabis space are saying. Big marijuana. I mean, how many people associate that with MSOs and other items? So again, I think that this is the time of the patient, and if we're not finding people and helping them get involved, we have a ton of resources that we've just revamped to help you with your advocacy. But I also want to remind people, like, advocacy isn't You don't have to like give up your life and become a nun or become Gandhi to make a change. And in our society, we love, making activist icons so that it feels like nobody else can do it, but a couple people can make change. And literally, we have all these tools. I want to get out of get out of your computer with your advocacy. What really happens if you win that war with J4D on Facebook? And we've created these posters you can print up. I made them like very like text light, so you can do it on your home printer and take it to a dispensary, take it to your campus, and put it up. And let's start having this conversation with other people. And I just like would challenge you all from when I send you this deck and this recording, how many other people can you have this conversation with? People that have no idea that we exist, no idea that there's all these people, that this is all we think about. Can you tell them about what's happening and why it's important that they participate? Not, go get a marijuana sweatshirt and start smelling like weed every day or whatever. I wasn't talking about me, but like just show up with you when you need extra support. So I'm just gonna let everyone. Cody, any final words and final thoughts?
Uh, this isn't the end. I think I've seen a lot of fatalist takes. This is another challenge. There will be some businesses who their business model, depending on what they chose to build around the language in 2018, will have to change, fail, or go. However, I do believe there's still some hope for industrial hemp and all the good things we've heard that hemp can do for America. I think it's good that we've put clearer language around what is THC, what is a synthetic or semi-synthetic, and that we're going to get further clarity. And it's on us to continue to advocate and be experts in this space to try to disseminate sort of healthy information in that way. And this 0.4% cap is going to affect patients. It is going to limit access. That's why we need your help in the next 90 days, the next 365 days, to fight, to borrow some words from a very popular man right now, to really kind of get what we need for our community to successfully sort of, I want to take medical cannabis over the finish line. We've come so far since ASA in 2002. By the way, I wasn't involved. I'm relatively new, but the point is this: where we are today is not out of nowhere. It has been a crawl to here. This is another bump in the road and another pivot, but we'll get through this too, but only if we do it together. That's all I have to say.
Thanks, Cody. Dr. Vinegar?
No, I just think it's everything you've said, Cody said, and we just have to keep working on it.
I know it's never the answer people want. It's like the answer is more
Keep
work.
going.
Pam, final thoughts?
Yeah, I'd be the man or the woman in the arena. It's one of my favorite speeches, right? If you're not bruised and bloody from the fight, then you weren't in the fight. And I think that everybody's in the fight. So to dig and use that kind of momentum of tiredness, but it's a collective tiredness. So lean on each other and show up. I nothing moves the needle more than personal touch point stories, right? I think that's one of the things that is lost in Congress is people go in and talk about the businesses, the business economics, and they fail to put the right face on it. I mean, better or worse, the TikTok video, since that's now how everybody gets news, from Trump was about CBD in the elder population, right? Like it is those sort of salient touch points. Unfortunately, as humans, we are fragile. We all know somebody who is sick or who has been sick, or we have been sick ourselves. And likely in today's world, thankfully, most of them have found some benefit in cannabis. So you may not be a cannabis patient yourself, but you probably know somebody who is. And even if you take it not for what you deem to be medical, but wellness, that's still somebody that's an advocate for the medicinal benefit of the plant. So that would be my thought, is just show up. Your story matters.
I think it's also okay to like put some peer pressure into advocacy. I mean, um, one of my favorite things to say, and I would love if more people would say it, so I just don't seem like the advocate bitch. But like, if somebody is telling me that a problem about a law, I say, "Oh, what does your member of Congress say?"
Ooh.
Like, do you know who your member of Congress is? And I say, like, let's call them and see, like, because that's if you don't do that, there's no hope. Like there's literally no hope. And so if
That's the way
somebody is
democracy
complaining
works.
about cannabis, I literally am just like, well, what did your member of Congress say? And if they haven't talked to them, I don't want to hear it. Like honestly, like I can't. I feel like I have a lot on these shoulders already, even the 80s style shoulders. But
A lot of padding.
but yeah, but if if we all just do a little, we're gonna get there, and we have been getting there. But I think one of the things that I definitely felt in the sort of adult use and hemp world was, everybody talks about pushing a rock up a hill. And it's hard and it takes a long time, 23 years, but nice, Cody. I don't want to know what's happening there. But what people don't talk about is actually how hard it is to control that ball when it goes down the other side. And I think that when we look at cannabis advocacy, it just turns out it's not just one hill. And so I think what we're dealing with is, there has been damage from what has happened around hemp and around a lot of sort of out of control or perceived to be out of control products, and we have to address it. Don't get defensive. If something is upsetting you about hemp, it's probably upsetting somebody else, and let them be upset, right? Like say you're right. That's horrible. We should deal with that. And then the last thing I want to say is that as things are unfolding around whatever happens at the 90 days at FDA, whatever's going to happen with CJS, whatever is going to happen with the enforcement of, I mean, I think we're actually going to start seeing enforcement way before the 365 days, is that retailers are the most visible. So all these head shops everyone rolls their eyes at or whatever, like this is where I bought like sandalwood soap my whole life. Like talk to those people about their rights, make sure they understand that they can get in trouble. Print up our Know Your Rights cards, print up our, how to be arrested, because those people we're just trying to make a living too, right? They don't necessarily know the laws. The person they bought it from told them it was legal. And so just make sure that if you know your rights, don't keep it to yourself. Let's get through this, whatever it is, without incarceration, mass incarceration, because that is not medicine for anyone. Okay, I hope I see you guys tomorrow at 2 for the town hall. You're gonna see lots of fun new opportunities, and I think we should just have like a regular check-in, guys, for the countdown. Like, let's do a 45-day. What's happening? Okay.
That sounds great. And I was
Thanks,
just,
everyone.
Perfect.
yes,
Bye-bye.
perfect.